Okay.
We can hear. Yes.
Auzu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum, all professor, teacher, students, organizer, and the vet and guest all over the world. Please accept my regard. I wish I will be there to welcome to you guys, especially for international guests, but please accept my apologies. Due to some reason, I cannot make it. Hope you have wonderful time at Lahore. Let's start the subject. I have evidence-based medicine. What is the evidence-based medicine? Why I'm forcing this one evidence-based medicine? Because this is a very important subject for in human medicine as well as in veterinary medicine. If you know what you are treating on your patient, that will give the most benefit the patient, owner, and as well as your practice also. If you are treating without any evidence, there's a risk factor for the patient also. The patient maybe go worse or maybe go better. It's very hard to say without evidence of medicine. This is the quality of medicine right now we're using in the USA or all the advanced country. And I really appreciate, I want to see that this same evidence-based medicine apply in my country and Pakistan also. The evidence-based medicine is the use of the most current best evidence making decision regarding the treatment of specific patient is known as evidence-based medicine. Evidence-based medicine combines the best available research data with the clinical experience and patient value and other factors. The most important factor in evidence-based medicine is the physician clinical experience. If you have very good clinical experience, then you will diagnose a disease within 1 minute. If you don't have a clinical experience and you don't know what are you treating, then it's very difficult. The clinical experience is most crucial part in evidence-based medicine. Most of the time, whenever I have a client coming in my hospital, I have the vet student working with me, I have like my tech working with me, they go in the room, they take all the history and everything, and then they come back and they want to explain me what's going on. And to be very honest, I discuss with my student also, and whatever I tell them, this patient maybe has this disease, let's do this test. Most of the time, 99%, 85%, whatever we discuss is coming same thing, whatever the test. So the clinical experience is most important to diagnose a disease. This is the patient. I don't need to explain like a lot of things because I have only 15 minutes to go over a lot of things with you guys, okay? This patient has like a clinical sign. If you look on this one, it's a very clinical ulcer. That's called rodent ulcer. Sometimes the board, the AVM, they also cause this question. The treatment is very simple. There's no need for a lot of diagnostic tests for this type of disease. If you have a clinical experience and if you see the disease before, you don't hesitate to say the client, oh, this is a rodent ulcer. And the treatment is very easy. This like if we give like a 2 injection, is a broad spectrum injection, is remain in the body like a 2-week dapomedrol steroid injection. And after 2 weeks, the giving the injection, the ref, one side is completely healed up, the other side has a little bit ulcer left, but hopefully after the second injection, it will be go away. This is a very interesting case which I like to discuss. I just see this case on March 10. How long you were sick?
I'd say since like the first of the year.
Like
Since
almost
like December, like January 1st.
almost like a 2 month, is it? On and off.
On and off, yeah. Like she would seem to get better, and then it would get worse. Like she'd have a few days good, and then she'd start throwing up again or have diarrhea again, and then she would be like lethargic. It's been pretty bad. Like she won't eat at all this past week. She got really sick, like threw up 7 times on Friday.
This patient is sick for like almost like a 2.5 month, or maybe more than like it, almost like a 3 month, according to the owner. They go their visit to their regular vet, diarrhea, vomiting, on and off, and the last 4 or 5 days is very weak, not eating anything. Of course, you give like his regular vet, like at least like a 2.5 months. They are just treating the symptom. They don't know what are they treating. Finally, they're coming for second opinion to our hospital. After checking all the clinical sign, all the symptom, I tell the owner, we like to do only one test. That's called leptospirosis test. The owner say, why you want to do this test? I said, listen, all the clinical sign, whatever I'm looking right now, is all the clinical sign, most of the clinical sign this patient has. And I like to do only one test, okay, to see what's going on, okay. The owner said, that's okay, that's fine. When we check the test, this patient is positive with the leptospirosis. The leptospirosis is a zoonotic problem, is a life-threatening case in human being also. Sometime in human, you will see it transfer to dog to human also with whenever you touch the urine of the animal. Sometime if you have a cut or anything wound on your hand, you can contaminate, you can get also that disease. Sometimes the sign in human is very mild, like a flu-like. Sometimes the sign is very severe, organ failure, even the death. So I highly appreciate all the veterinarians who are practicing in Pakistan. Force this one. Vaccination is the only solution to prevent the disease. Vaccination is very important in this case. And the drug of choice is the doxycycline, the drug of choice, this one. And plus, of course, we get anti-nausea medicine also. But keep in mind, whenever I see this case, before I go in the room, I tell my technician, my student, please wear the gloves because this is a highly contagious disease. This is all the notes you can read, like all whatever we write on in USA. This is like a subjective, whatever the history, objective, whatever we see, assessment, whatever we see, planning, whatever we did the planning. I just write down, give like screenshot of my notes. So you have like a student or the professor, you can see this one also. This is a treatment chart because last time a lot of students, they say, sir, what are you treating? You can read all my treatment, whatever you give for this patient. This is another very interesting case, okay. The Maggie, it was sick, panting, not feeling good, feeling a lot of pain, did not sleep very well. Owner go to his regular vet, they check everything, they check the blood work, everything. And after that, they say maybe the patient has UTI, urinary tract infection. They did ultrasound. They also find that they have like liver nodules. But after giving 5-7 days medicine, the patient does not feel very well. Then finally, he go to the emergency hospital, like a 24-hour emergency hospital. And because the patient did not sleep all night, and the owner is also very upset. And when they go to the emergency hospital, they check everything. They say, oh, look like this patient has like something like a nervous degenerative disease. Okay, they give the pain medicine and also for the nerve pain medicine also. But the patient still did not feel very well. After 2 days or something like, is one of my client, his friend, and my client say, why not you go to the East Windsor Animal Hospital? Maybe my vet can help you. When they coming in my hospital, when they explain everything, believe me, within 4 or 5 minutes, I say this dog has something like a tick-borne disease. Let me check this test. Let me check the blood work and let's see what's going on. Okay. The owner say, okay, go ahead. When we check the test, this test is coming positive with the E. canis. E. canis is also like a tick-borne disease. And also anaplasmosis. Both are the tick-borne disease, okay? When we check his blood work, all the liver values high. When I see the glucose is also very high, then I feel why is painting, why is not doing very well? Because the patient also has the diabetes, and plus the patient suffering a lot of pain because due to this disease, E. canis and anaplasmosis, they cause like a lot of pain. All the tick-borne disease in human and the dog or pet, they are treatable, but it's not a curable 100%. Keep in mind, these are also the board question. They are treatable, but not 100% curable. If they coming like E. canis one time positive, they will be positive for the rest of the life. Whenever the dog become lethargic, depressed, the disease come back again, and you need to repeat the course of treatment again. Of course, we check his other blood work also. We check his urine also to make sure it doesn't have diabetic ketoacidosis, everything. And these are the treatment chart or whatever we give the treatment for the pain medicine, doxycycline, liver supplements for the liver, and insulin also. And also, of course, we send over the anti-nausea medicine also. These are the medical notes you can read like later on whenever you have a time for the students. And also these are the treatment. I cannot go like all this treatment because I have only like a few minutes left more. The doxycycline is a drug of choice, all the tick-borne disease. And these insulin is for the human insulin. These are the generic, this is much cheaper. I like this one. I send home with this medicine, this insulin. These are the FDA approved for the dog and cat, but it's very expensive. Vetsoline is also very expensive. If you look, this conversation about the Maggie.
This is a story about Maggie. I got Teddy with her son, and I got Leonidas over there. Maggie had issues with, she was crying a couple days in fall. And when I went to my regular vet and she got diagnosed with nodules on her liver, spleen, and she had a urine infection. And she gave me some antibiotics and a painkiller. And she told me if it gets worse, then just bring her to the hospital. So when she's crying day and night, and by Tuesday, something like that, Wednesday, I went to North Vet Hospital in Robbinsville. And after 4 or 5 hours, they told me she had a chronic degenerate nervous system, which I found ridiculous. And they gave me painkillers and sent me home. And still crying. Then Thursday, my colleague said, why don't you try East Windsor Hospital? He goes, they might help you out. So, I mean, when you don't sleep 24 hours for 10 days, me and her trying to calm her down. I brought her to East Windsor Hospital, and my first impression was, I saw a picture of Dr. Rashid with a lion. So this is the Lion King doctor, so I think he can take care of her. And it only took him like 5 minutes to tell me she's got Lyme disease, the way she walks, and the way she's acting, she's all in pain. So he did a test blood work. He goes, I'll do a full spectrum of the blood work. And he comes back, he goes, definitely Lyme disease, and she's diabetic. That was a shocker to me, that nobody could pick up that. And he said that this is common.
Okay, this is a Eva.
This is Ava. She had renal carcinoma 2 years ago. She had one kid.
I removed this kidney like a left kidney, and it's still doing very well. This renal cell carcinoma, I know some of the professor, medicines, humans is also sitting here. Renal cell carcinoma is very aggressive tumor in human and as well as in pet, but without any chemotherapy, anything is still doing very well. We're using some alternate medicine. It's experiment medicine we are giving right now, a special Chinese herbal medicine. I like to show like some couple of things, but I don't have like it to my time right now. I have left only like a 4 minute. This is like abscess. So we also did like a root canal, everything, but the clindamycin is my favorite drug in case of the teeth abscess. This is another very interesting case. This patient, when came in our hospital from the other hospital, and he has like a big tumor. They did ultrasound, everything. When we took the x-ray, the patient collapsed. Then we stabilized the patient. And after stabilize, I told the owner, we need to remove this tumor right now. Otherwise, it's very difficult to save his life. And of course, we took the x-ray and we see the big tumor here, where the spleen has a big tumor. And when we took the this one will go forward, let one move.
It's wrapping up 3 minutes.
Even with the during surgery, the tumor is already ruptured from this area. If you look like a, I just want to go forward. It's a very nasty tumor, like a almost like a 10 centimeter. This is after like a 3 hour. Start eating food very well.
Good.
The end point is that if you know what are you treating, that's the best thing for the patient and for the owner also. But if you are doing without any evidence, then it's very difficult for the client and for the patient also. Sometimes they're suffering a lot of pain. Same thing, I see the patient, the Maggie owner, believe me, when I tell in the room, this dog has like a positive with a Lyme disease and plus also had the diabetes. He was crying on the tape on the exam room. My technician, my student, always witness this thing. He was crying on the room. Okay. He said, my dog is suffering at least like a 10 days, 12 days. No one pick up this one. Okay. And I really appreciate, I know in Pakistan is we have very limited facilities and everything, but still, if anyone sitting government or anything like a member or something like this, is my message. Please, we are the veterinarian. We play key role in the economy in any country, and also we also take care of the pet health and as well as human health also. The veterinarian working in Pakistan in education, in field, livestock, wildlife, they are working very hard with limited facility. They're doing their best. They need at least appreciate. Please appreciate them, their services. And I hope I go like a very fast. I'm sorry for that because we have only time limit. I have only like a 1 minute left, and that's it. If you have any other question, concern, please let me know. I can answer your question maybe later on, or maybe you can text Professor Dr. Anila Durrani, and he maybe convey me any question from the students or teacher or professor, whatever you have in your brain, please let me know. Thank you for watching this presentation. I'm sorry I go very fast. If someone does not understand, I apologize for that. Thank you and have a wonderful day.